All right, welcome to another deep dive. This time, we're going to explore something super interesting. We're diving into community health nursing in Canada.
Sound good.
So we've got some excerpts here from a nursing textbook, and we're basically on a mission, right?
Yeah.
To unearth those like golden nuggets of knowledge, those things that make you go, whoa!
I love that.
Right, those insights that make you kind of rethink things.
Yeah.
So before we get too deep into it, let's make sure we're all on the same page. Like, what exactly is community health nursing?
Well, I think a lot of people, when they think of nurses, they think of hospitals.
Yeah, bedside.
Right, exactly.
Yeah.
Giving medications and that sort of thing. But community health nursing is much more than that.
So it's not just about, like, taking temperatures and giving injections.
It's definitely not just about that. Although those are part of it, they use all their clinical skills, but the focus is on the bigger picture, you know?
So almost like health detectives.
Exactly.
They're out there.
Yeah.
Working with individuals.
Individuals, families.
Families, whole communities, and trying to figure out how to not only treat illness, but prevent it.
Exactly. That's a great way to put it.
Wow.
And the cool thing is, this approach is gaining so much recognition. In Canada, almost 16% of nurses are community health nurses now.
Wow. That's a lot.
It is, and it's steadily growing.
So that means they're working in all sorts of places,
Right.
not just hospitals and clinics.
Exactly. They're in public health clinics.
Right.
They might go into people's homes.
Oh, wow.
They might even work on the streets,
Oh, interesting.
connecting with people who might not have access to those more traditional settings.
Wow, that's amazing. Okay, so we've got this whole other side of nursing that most people don't even realize exists. But how does this all fit in with, the Canadian healthcare system?
Yeah.
Because that's a unique beast in itself.
It is, but it works really well.
Yeah.
It's basically this partnership between the federal government and the provincial and territorial governments.
Okay, so it's like a team effort?
Yeah, exactly. The feds, they set the big picture, the overall guiding principles.
Which are?
Well, you've got universality, accessibility, comprehensiveness, portability,
Oh, yeah, I've heard of those.
and public administration. So these 5 pillars, essentially, they guarantee that healthcare is a right for all Canadians.
That's awesome.
It is.
So no matter your background,
Doesn't matter where you live,
you
have access to healthcare.
Wow, okay. So the federal government sets the stage, and then the provinces and territories, they actually run the show, right?
That's right. They organize and deliver the actual services.
Oh, okay.
They also have the flexibility to adapt and innovate. For example, community health centers.
Yeah.
They've really been spearheading the creation of those, which focus on providing care to underserved populations.
That makes a lot of sense.
Yeah.
Because that seems like a perfect setting for these community health nurses to really connect with people who need it most.
It is, absolutely.
Okay, so speaking of reaching people, there's this term that kept popping up in the text, population health.
Yeah.
It sounds a little intimidating.
It does sound a little bit like that.
Yep.
But really, it's a pretty simple idea
Okay.
and kind of revolutionary when you think about it. We're shifting our focus,
From what?
not just on treating individuals, but considering the well-being of entire communities.
Oh, I see.
So instead of waiting for people to get sick, we're like, how can we create the conditions where everyone can be healthy and thrive?
So it's like preventative medicine,
Exactly.
but on a massive scale.
Exactly. That's a great way to put it. You know that saying, a stitch in time saves 9?
Yeah?
Kind of like that.
Oh, okay.
If we address the root causes of health issues, we can prevent a lot of suffering down the road. It's about thinking long term.
So, like, instead of just rescuing people who are falling into a river, we're trying to figure out how to keep the river healthy in the first place.
That's a perfect analogy.
Right.
Yeah, I love it. And Canada has really been a leader in this movement towards a broader understanding of health.
Oh, cool.
Yeah, it's been this gradual but significant shift.
So what kind of things have helped drive that shift?
Well, there have been some landmark reports that have really shaped the way we think about health, like the Lalonde Report, the Ottawa Charter, the EP Report. These were all pivotal moments that highlighted how social and environmental factors play a role in our well-being.
Wow. So it's not just about genes and lifestyle choices. There's a lot more to it than that.
Way more. The text kept emphasizing these determinants of health.
Yeah.
It's this whole web of factors.
Okay, so give me an example, something that really brings this to life.
Okay, so think about this, right? Studies have shown that people with higher incomes tend to live longer and healthier lives.
Okay, that makes sense.
But it's Not just about being able to afford like fancy gyms or organic produce.
Right.
It's deeper than that. It's about the stress that comes with financial struggles.
Sure.
The lack of access to healthcare,
Yeah.
even the neighborhoods people live in. All of these things can impact health.
So it's like poverty itself
Mm,
is a health risk factor.
exactly. And it's woven into so many aspects of a person's life.
Wow, that's powerful. Okay, so income is one of those determinants. Are there others?
Oh, yeah, there's a whole bunch.
Okay.
The text lists 12. Income, education, working conditions, early childhood experiences,
Oh, wow.
the physical environment,
Yeah.
social support networks, healthy behaviors, access to healthcare, biology and genetics are in there too.
Right, so some things you can control and some things you can't.
Exactly.
Okay, so that's 12 determinants.
12.
And you said they all sort of interact and affect our health.
Yeah.
Do we know how much they actually influence our health? Like, is there a percentage or something?
There is.
Oh, cool.
It's estimated that a whopping 75% of our health status is influenced by these social determinants.
Wow, 75%. That's huge.
Isn't that crazy?
It really puts things in perspective. Like, focusing just on individual behaviors and medical treatments is only part of the story, right?
Exactly. It's like we're only seeing a small piece of the puzzle.
Wow.
If we really want to make a difference in people's health, we need to address all those other pieces, those social and environmental factors that are playing such a huge role.
Yeah, and that's where community health nursing comes in.
Exactly.
Okay, I'm starting to see the connection here. We've got community health nurses working within a system that guarantees health care for all Canadians.
Right.
And they're approaching health from this big picture, population-focused perspective.
Right.
They're considering all these factors that can impact well-being. It's a totally different way of thinking about health, isn't it?
It really is.
Yeah.
And it leads to some really interesting questions about how we approach healthcare as a society.
Like what kind of questions?
Well, if we know that these social determinants are so influential,
Right.
does it even make sense to treat everyone equally? Or should we be striving for a system that actively addresses those underlying inequalities?
Ooh, that's a tough one. I can see how this line of thinking could create some tricky ethical dilemmas for these community health nurses.
Absolutely. It's something we need to think about carefully. We've laid a solid foundation here, but we've got so much more to uncover about community health nursing in practice. Are you ready to dive deeper?
I'm ready. Let's do it. So we've been talking about how community health nurses, those CHNs, they're like looking at health from this big picture perspective. And I'm kind of curious about this whole public health practice thing. Is that where those ideas really come into play?
You got it. Public health. Think of it like this giant umbrella
Okay.
covering all these efforts, all these organized efforts to keep entire populations healthy and safe.
Wow. So it's even bigger than primary health care.
It is. It is. Primary health care is definitely a big part of it, but there's so much more to it. Like, those food safety inspections, making sure the food we eat is safe. That's public health. Clean drinking water initiatives, those vaccination campaigns,
Right.
keeping those outbreaks at bay, all of that falls under public health.
Wow. I never really thought about how much goes on behind the scenes just to keep us all healthy.
I know. It's amazing.
The text mentioned these 6 key areas of public health practice.
Mhm.
What are some of those?
Okay. Well, one of the big ones is health protection. These are the efforts that basically shield us from all these threats to our well-being.
Okay.
So, have you ever thought about how the food you eat is actually kept safe from the farm all the way to your table?
Not really.
Yeah, a lot goes into that.
Huh.
Or how regulations protect us from environmental hazards.
Right, like pollution.
Yeah, pollution, toxic waste, all that stuff. Public health is working behind the scenes on all of that.
Wow, it's like a silent guardian,
It really is.
protecting us from dangers we don't even see. Okay, so what else is under this giant public health umbrella?
Okay, well, another big one is health promotion.
Oh, yeah, we touched on that a bit before. It's about empowering people to make healthy choices
Yeah,
and creating supportive environments where everybody can thrive.
exactly. So think about educational campaigns, right? About the dangers of smoking, initiatives that encourage people to get out there and be more physically active, even things like community gardens.
Right. Those are great.
Yeah, they're amazing, right? They bring people together, increase access to fresh fruits and vegetables. It's a win-win.
It's amazing how those little things can actually add up to a healthier society.
They really do.
This makes me wonder, though, how do public health officials even know where to focus their efforts? It's like a giant puzzle.
Right. That's where population health assessment comes in. It's all about gathering data,
Oh, okay.
analyzing trends, and just listening to communities.
Hmm.
Figuring out what their needs are, what their strengths are.
So it's like taking the pulse of a community.
Yes, exactly.
Let's
And then using all of that data to really drive those public health initiatives and make sure that they're actually effective in meeting the needs of the people that they're supposed to serve.
Makes sense. Okay, so that's population health assessment. What's next?
Okay, so then there's health surveillance,
Okay.
which is like being a detective, basically. It's about constantly monitoring these health trends, tracking outbreaks, looking for those early warning signs that something might be going wrong.
So that sounds pretty crucial, right?
Oh, it is.
Especially these days, like diseases can spread so quickly.
Absolutely, you're right. And of course, you've got disease and injury prevention.
Okay.
This is where public health gets really proactive. They implement all kinds of programs and policies to help prevent problems in the first place.
Mm-hmm.
So think about like vaccination schedules,
Yeah.
workplace safety regulations, those educational campaigns to highlight the dangers of things like distracted driving.
Right. So it's about creating those safety nets.
Exactly. Catch people before they fall.
Uh-huh.
And then lastly, we've got emergency preparedness. This is a big one. So think about natural disasters,
Right.
disease outbreaks, even bioterrorism threats, like all the what ifs.
Right.
Public health is responsible for making sure our communities are ready to respond to all those scenarios.
So it's like hope for the best, but prepare for the worst.
Exactly.
But like on a community level. Okay, so this is all very impressive, but I gotta ask, how effective are all of these initiatives? Can you really measure the impact of public health?
Oh, absolutely. Public health has a track record of amazing successes. Like think about how sanitation and immunization programs have increased life expectancy over the past century. It's remarkable.
Wow, yeah.
We rarely see diseases like polio or smallpox anymore, and that's a direct result of public health interventions.
That's pretty amazing when you think about it. It's like public health is always working in the background, protecting us from stuff we don't even realize.
I know, it's amazing, but that doesn't mean the job is done, right? As infectious diseases have become less of a threat, chronic diseases like heart disease, diabetes, cancer, they're on the rise.
Right.
So that shift presents some new challenges for public health.
I bet. Because it requires a different way of thinking, right?
Exactly. We have to recognize that complex interplay, between those social determinants of health we talked about and how they contribute to chronic diseases. It's not just about treating the symptoms. It's about addressing those underlying causes.
It all circles back to that 75% statistic, doesn't it?
It does, yeah.
If our health is so heavily influenced by our social and environmental circumstances, public health can't just focus on individual behavior, right?
Exactly. They need to tackle those bigger picture issues, those upstream causes, and create communities that actually support well-being.
Okay, so speaking of those who work on the ground, can I just clarify something? Are community health nurses and public health nurses the same thing?
Yeah, it can be a little confusing.
Yeah.
But basically, all public health nurses are community health nurses. But not all community health nurses work in public health.
Oh, okay.
So it's kind of like all squares are rectangles, but not all rectangles are squares.
Got it.
So public health nurse is a CHN who focuses on those initiatives we've been talking about.
Right, like disease surveillance.
Yeah, health promotion campaigns, emergency preparedness, all that.
And it sounds like they need a pretty diverse skill set to handle all that.
Oh, definitely. They're not just clinicians. They're educators, counselors, advocates, researchers.
Wow.
They even wear a detective hat sometimes.
That's amazing. And this makes me think back to that river analogy. Public health is trying to prevent people from falling into that river of illness.
Yeah.
And the text mentioned different levels of prevention,
Yes.
like primary, secondary, and tertiary prevention.
Exactly. It's like a three-pronged approach to protect health.
Okay, break that down for me.
Okay, so primary prevention. That's all about stopping those health problems before they even start.
Okay.
So imagine those vaccination programs that protect kids from preventable diseases.
Right.
Or public service announcements urging people to wear helmets while biking.
Yeah.
All about preventing those injuries.
So it's creating a culture of safety.
Exactly.
And well-being, making those healthy choices the easy choices.
Exactly. And then we've got secondary prevention. That focuses on early detection and treatment of health problems. So think mammograms to catch breast cancer early.
Okay.
Regular blood pressure checks for hypertension. Vision and hearing screenings for children.
So it's about catching those problems early on when you can really do something about it.
Yes. before they spiral out of control.
Yeah.
And then lastly, we have tertiary prevention.
Okay.
This is about managing existing health conditions and preventing complications.
Okay.
So think cardiac rehabilitation programs for heart attack survivors,
Right.
support groups for people dealing with chronic illnesses, even those home visits from nurses, making sure people stay on track with their medications.
So it's about support and maximizing quality of life,
Exactly.
even when someone's facing health challenges.
Exactly. Making sure they have the resources and support they need to really live their best life possible.
Wow. Okay. So we've got these 3 levels of prevention all working together, each playing a role in keeping communities healthy. That's pretty impressive.
It's amazing.
But there's one more layer to this whole prevention thing, right?
Yes. Primordial prevention.
Primordial. What's that?
It's a newer concept. It focuses on tackling those underlying social, economic, and environmental factors that lead to health problems in the first place.
So even before primary prevention.
Exactly.
Wow.
It's about creating a society where everyone, no matter their background, has the opportunity to be healthy.
Okay, so it's like public health is evolving,
It is.
becoming even more proactive, and really recognizing those deep connections between social justice and well-being.
Absolutely. It's not just about reacting to problems. It's about shaping a healthier future for everybody.
I'm really sensing a theme here. It seems like this whole community health nursing thing is about connecting the dots,
Yeah.
between those individual health concerns that we all have and those big social forces that can really impact well-being.
Exactly. And that brings us to the expanding role of these CHNs.
Okay.
They're not just confined to those traditional public health settings anymore.
Oh, really? The text mentioned that they were branching out.
So now you see CHNs working in home health,
Oh, wow.
providing care to patients right in their own homes, and occupational health, making sure workplaces are safe and healthy for employees. And then we see CHNs in more specialized areas like forensic nursing, which involves caring for victims of violence,
Wow.
and parish nursing, where they provide support to faith communities.
I never knew the scope was so broad.
I know, it's incredible.
But with all these different roles, how do we make sure that all these CHNs are providing consistent high quality care?
That's where the Canadian Community Health Nursing Standards of Practice come in.
Oh, right.
They're like a compass,
Okay.
guiding CHNs, making sure they meet all the ethical and professional expectations.
Okay. Remind me what those 8 standards are again. What do they cover?
Okay, so first and foremost, health promotion. CHNs, they need to be champions for well-being
Okay.
at every level, individual, family, and community.
Right.
And then, prevention and health protection, putting those upstream thinking skills into action, health maintenance, restoration, and palliation.
Okay.
Those guide CHNs in providing holistic care throughout a person's entire lifespan.
So it's not just preventing illness, it's about supporting people through those times when they need care.
Exactly.
Okay.
And another key one is professional relationships. Building strong relationships with patients and their families and their colleagues.
Right.
That's super important.
Makes sense.
And then you've got capacity building. This encourages CHNs to empower individuals and communities to take control of their own well-being.
So it's like the whole teach a man to fish philosophy.
Exactly, but for health.
I like it. Okay, so what about the last 2?
All right, so we've got evidence-informed practice.
Okay.
This basically means staying up to date with the latest research and using those findings to make the best decisions for their patients.
Makes sense. Got to keep learning.
Exactly. And finally, professional responsibility and accountability.
Right. So making sure that CHNs are being ethical, accountable for their actions, and always putting the patient's best interests first.
Yes. All of these standards, they create this amazing framework to make sure that CHNs across Canada are providing safe, compassionate, and effective care, no matter what their role is.
I'm starting to get a sense of how deep and complex this whole field is. It's so much more than just nursing,
It really is.
It's about combining those clinical skills with, an understanding of social issues and public health, even ethics.
You got it. It's all connected. And all of this leads to a very specific model of practice for community health nursing in Canada.
Okay, don't leave me hanging. Tell me more about this model.
All right, so it's called the Canadian Community Health Nursing Professional Practice Model and Standards of Practice.
Wow, that's a mouthful.
I know, right? But it's really about providing a clear framework for CHNs.
A framework for what?
For understanding, The unique context of CHN practice here in Canada,
Okay.
those fundamental values that drive the whole profession, and the process, the practical steps that CHNs use to actually make a difference in their communities.
So it's like a blueprint
Yes,
for their day-to-day work.
exactly.
All right, so we're back, and we're going to dig into this
Yes.
model of community health nursing. Lay it on me.
Okay, well, remember how we talked about those 8 Canadian community health nursing standards of practice? Things like health promotion and prevention and all that. Yeah, those were pretty important.
Well, those are like the bedrock of everything. This model takes those standards and shows how they actually play out in real life. It's not just a list of ideas, it's like a guide for action.
So it's like taking those standards and making them, like, practical.
Yeah, exactly. Remember that image in the text? All those roles that CHNs play? Advocate, clinician, educator, counselor, even researcher.
Yeah, it was a lot to take in, like all those different hats they wear.
I know, right? Well, this model shows that no matter what hat a CHN is wearing, those 8 standards are always there, like a guiding light.
I see, so it's like a compass, always pointing them in the right direction.
Exactly. And there's this thing called the community health nursing process that's also part of the model. It's basically a problem-solving approach, a way for them to figure out what needs to be done, make a plan, do it, and then see if it worked.
Okay, hold on, walk me through this process. How does it actually work? All right, so first step is assessment. Let's say you've got a CHN working in a neighborhood with high rates of childhood obesity. They wouldn't just jump in with solutions. First, they got to gather information, talk to families, look at health data, maybe even just observe what kinds of food options are available, what kind of places there are for kids to play and be active.
Right, so get a feel for what's really going on.
Exactly. Then it's planning time. This is where those collaborative skills are super important. They would work with the community, with local organizations, maybe even policymakers, to come up with a plan, one that's tailored to those specific needs.
So it's not about imposing solutions from the outside.
No way. It's about working together with the community to find solutions that will actually work.
That's great. Okay, so then what?
Then it's time to actually do it, put the plan into action, right? That's implementation. Maybe the CHN is organizing healthy cooking classes, or advocating for safer parks, or connecting families with food banks, or nutrition counseling.
So really making a difference.
Yeah, that's the goal. But it doesn't stop there. They have to keep checking, like, are obesity rates going down? Are families feeling more confident about making healthy choices? Are those resources actually being used?
So like a constant feedback loop.
Exactly. Always making adjustments to make sure things are working the way they're supposed to.
Okay, so we've got this process, we've got the standards, and all of it together makes up this Canadian model.
You got it. It's a holistic approach, it's adaptable, and most importantly, it puts the community at the center of everything.
Man, this model really aligns with everything we've talked about. The social determinants of health that focus on prevention and promoting health, all the different roles that CHNs play, even the values of equity and social justice, it's all connected.
It really is. And I think it shows that community health nursing is more than just a job. It's like a calling. It's recognizing that we're all responsible for each other's health and that we can work together to create these amazing, thriving communities.
That's beautifully said. I gotta say, this deep dive has been really eye-opening. Like, I'm looking at community health nursing in a whole new light.
Me too.
Yeah.
And it's a field that's always growing and changing. But, those core values, things like compassion, equity, community engagement, those always stay the same.
That's awesome. Well, on that note, I think we're going to wrap up our exploration of community health nursing in Canada.
Yes, thank you for joining us.
We hope this deep dive, made you think a little differently about things. And hey, if you want to learn more, we've got a ton of resources on the episode page. Thanks for joining us on the deep dive. Until next time.